The Decubitus chest x-ray is performed whenever a patient is not able to stand up and the doctor is wanting to get an idea of the fluid level in the lung. And when you do it in a decubitus position, you see air fluid levels very well. The thing you have to remember is you lay the patient on the side in which the fluid is in. So we'll pretend David has a history of fluid in the right lung. So I'm going to have him lay on his right side. It's usually best to have them lay on their side for about 5 minutes before the exposure to ensure that the fluid does get layered well for the examination. So here he is laying on his right side. I've got the cassette holder behind him and I've got it placed behind his back in the area of the chest. Now I do want to check and make sure I can see some light field above the shoulder because we want to be sure we don't cut off the apices. So you can see about 1.5 inches on the light field. We're going to center longitudinal line down mid-sagittal. We want to be sure that our light field is open enough that it includes both sides of the chest. Now one more thing that really helps when you do these decubitus is propping a sponge underneath the side. And this ensures that the side down does not get cut off. So we're going to build that side up. Okay. Now I'm going to bring this arm above the head. Now one adjustment I can make is to open up the light field to make sure I don't cut off the side that's up. Okay, so now we can see this shadow here. So we're seeing the left side up, the right side down. Then we're going to mark the side that is up. So since left is up, I'm putting my left marker there. So this is considered as the right lateral decubitus chest. You'll have the patient take in 2 deep breaths and then hold it on inspiration. So if your doctor's order has fluid in the left lung, then instead of doing this right lateral decubitus, we would have the patient laying on their left side. So I'll go through that real quick, showing how we'll just simply have them roll over to the opposite side. We keep the sponges underneath them. Okay, we check, we want our line to be centered over the spine. Have the IR right up against the chest. Okay, and then we're going to place a marker indicating the side that is up. So our right side is up, so I will have the right marker on the upside. So this is our left lateral decubitus. Okay.